Hi, I'm Elda Hall. I'm a licensed mental health therapist working with Genuine Healthcare of the Pacific Northwest in conjunction with the healthcare authorities with Washington State. I'm here to give you a presentation on sports, which is substance use prevention optimization for robust teens. So the use of cannabis. We understand that the adolescent brain, your brain, in its stage, is still growing. What does that mean? You're still learning to regulate emotionally. You're still learning cognitively. You're still learning to perform various executive functions. Your brain's not fully developed. In fact, your brain is not fully developed until age 25. So avoiding the smoking of cigarettes, vaping, eating the wrong types of foods, or not even eating, or smoking cannabis or intaking cannabis can impair your brain functions, but also your physical functions as well. So, and also, there's the reaction to concentration, especially when you're in a school environment. Why vaping is a danger to us right now. Kids are doing it. Well, you find it in the bathrooms, you find it in schools, and lots of times the educators, their hands are tied. If they put things in their bag, they're not allowed to go to the bag to cover that evidence, from what I understand. They don't understand what is going on. The sad part is when they are doing these things, vaping for instance, it's highly addictive. One vape is equal to 50 cigarettes. From vaping, statistics shows that you will then become a smoker. And what are teens saying when they vape? Some of them are just vaping nicotine, and we all know why is there nicotine. It's to cause addiction. There's also marijuana in the vaping. Some teens have said yes, they use marijuana in vaping, and some have just said, hey, we just use it for flavoring. It's not a water-based compound. It's a chemical compound. It's aerosol is what they're taking in. Vaping is actually just associated with asthma, exacerbation, especially if you are prone to have asthma, if it runs in your family, exposure to unintended drugs like fentanyl, resulting in seizures, cardiovascular issues, burns, and even just traumatic injury. Fentanyl is also a big issue with, it's a big emergence of it. And this fentanyl is basically an opioid. It's a synthetic opioid. What's it used for? It's a painkiller, it's an analgesic, but what makes fentanyl more dangerous is the emergence of fentanyl-laced vapes. So it's a significant risk to teens because fentanyl is not only potent, but it leads to fatal overdoses. So, and with those illicit synthetic substance of fentanyl, they're also laced with other dangerous illegal substance as well. And of course, that's why there's a rise in incidents amongst our teens with harm and death. What you can do for yourself is really avoid the use of cannabis, marijuana, alcohol, tobacco, e-cigarettes, prescription and illegal drugs. Sometimes people take prescription drugs when they're not supposed to take. Hey, it's not illegal, it's prescribed. Yeah, it's prescribed, but is it for what you're using it for? Or are you using it because you want to use it, not because you need to use it? So you want to avoid taking in those substances that can deter your ability to judge the things that you want to do, take away, so you want to avoid those things that can take away your ability to control the things that you want to do. You want to be responsible for your ability to choose. And these things, or lack thereof, the lack of exercise or lack of physical activity, the lack of having a proper diet, the lack of sleep, they will impair your judgment and impair your choice. So what can we do? We can really promote our kids to be more active, get more 8 hours sleep a day, eat a healthy breakfast, or eat the right types of foods, do physical activity for at least 30 minutes, practice stress control. And today we covered a discussion on the importance of physical activity, sleep, diet, and the risk that substance use pose amongst our teens. There are consequences that vaping, fentanyl, and cannabis use all come with. We want to prevent those risks, and there's consequences that poor diet, poor sleep, lack of physical activities can contribute to that increases the risk in the health and well-being of our adolescents.